Medicare in 2025. What's changing? With major changes coming to Medicare in 2025, older adults need to stay informed more than ever. Medicare is a key part of retirement planning, covering essential healthcare costs that can quickly add up as you age. But with premiums on the rise and coverage rules shifting, these changes could directly impact your financial security in retirement. For those aged 50 and above, it's crucial to understand how these updates will affect your future healthcare expenses. Whether it's higher monthly premiums, new coverage limitations, or changes in prescription drug costs. These updates will influence how you budget for healthcare. Without proper planning, rising costs could eat into your retirement savings, making it harder to manage other expenses. That's why staying informed and reviewing your Medicare options each year is so important. The more you know about what's coming, the better prepared you'll be to adjust your healthcare plan and make smart decisions about your coverage. To give you a clearer picture of how these changes might impact you, let's start by going over the basics of Medicare, what each part covers, and how it fits into your retirement planning. Understanding these fundamentals will help you navigate the upcoming changes and ensure you're making the best decisions for your healthcare needs. Understanding Medicare basics. A quick refresher. Medicare is made up of 4 key parts, each covering different healthcare needs. Part A is hospital insurance. It helps pay for inpatient hospital stays, skilled nursing facilities, hospice care, and some home health services. Most people don't pay a premium for Part A, as long as they or their spouse worked and paid Medicare taxes for at least 10 years. However, there is a deductible. In 2024, it's $1,600 per benefit period. Part B is medical insurance. This covers doctor visits, outpatient services, preventive care, and certain medical equipment. Unlike Part A, most people do pay a premium for Part B. Currently, it's around $174 per month. There's also an annual deductible, which in 2024 is $233. After you meet the deductible, Medicare typically pays 80% of approved services. Part C, also known as Medicare Advantage, is a bit different. It's an alternative to original Medicare, offered by private insurance companies. Medicare Advantage plans must cover everything original Medicare does, but they often bundle extra benefits like vision, dental, or hearing coverage. Premiums for Part C vary depending on the plan and location, but some plans offer no extra premium beyond what you pay for Part B. Part D is prescription drug coverage. It helps lower the cost of prescription medications. Like Part C, Part D is provided by private insurers, and premiums vary by plan. In 2024, the average premium is about $31 per month. There's also a deductible, capped at $505 this year. Now that we've gone over the basics, let's move on to what's coming in 2025. Premiums and deductibles for each part are expected to increase. This will affect how retirees budget for healthcare, so it's important to stay informed about these changes. Premium increases for 2025. What to expect? In 2025, premiums for Medicare Parts B and D are expected to rise. For Part B, the monthly premium will increase from the current $174, likely reaching around $185. The exact amount depends on your income. Higher income retirees will see even steeper premiums due to Medicare's Income-Related Monthly Adjustment Amount, ERMAA. For example, someone with a yearly income of over $97,000 could pay as much as $560 per month for Part B in 2025. That's a noticeable jump compared to 2024. For Part D, prescription drug coverage, premiums are also expected to go up. In 2024, the average Part D premium is around $31 per month. However, this could rise to around $35 or even $40 in 2025, depending on the plan you choose. Like Part B, Part D premiums are also adjusted based on income, so higher earners will pay more. Someone earning over $97,000 could pay an additional $75 per month for Part D coverage. These increases in premiums and out-of-pocket costs will hit retirees' wallets hard. For example, a middle-income retiree paying about $200 per month in 2024 for Part B and D combined might see their monthly bill rise to over $225 in 2025. Over the course of a year, that's an additional $300 in healthcare costs. For retirees on fixed incomes, this extra burden may force some tough decisions when it comes to managing other expenses. As these premium hikes take effect, it's crucial for retirees to review their budgets and make adjustments where necessary. It might mean cutting back on discretionary spending or exploring supplemental insurance options to help offset rising costs. Next, we'll look at some of the changes in Medicare coverage for 2025 and how you can prepare for those shifts to better manage your healthcare expenses. Coverage updates, changes to Medicare benefits. In 2025, Medicare Parts A and B will see some important updates. For Part A, which covers hospital stays and skilled nursing care, the deductible will increase. Currently, the deductible is $1,600 per benefit period, but in 2025, it's expected to rise closer to $1,700. This means retirees will have to pay more out of pocket before Medicare starts covering hospital-related costs. The cost sharing for extended hospital stays and skilled nursing care will also go up, which could make longer recoveries more expensive. Part B, covering doctor visits, outpatient services, and preventive care, will also experience changes. The annual deductible, now $233, is expected to rise, making it a bit more costly for retirees to access outpatient services. One positive update is the expansion of preventive services. Medicare will begin covering more screenings and wellness visits, which can help retirees catch health issues early, potentially saving on future medical bills. However, with the higher premiums and deductibles, it's important for retirees to weigh these new benefits against their overall healthcare costs. These changes could lead retirees to explore different options for covering their healthcare needs. For those with more frequent hospital stays or ongoing medical care, supplemental insurance might be worth considering to help cover these extra costs. Staying on top of these benefit updates can also help retirees take full advantage of the new preventive services, which may help reduce long-term healthcare expenses. Now that we've covered the changes to Parts A and B, let's look at what's happening with Medicare Advantage in 2025 and how it compares to original Medicare. This will help you decide which coverage option best fits your needs. Medicare Advantage in 2025, new plans and options. In 2025, Medicare Advantage Part C plans will offer a few notable updates. Many plans will expand their additional benefits, such as including more coverage for vision, dental, and hearing services. Some plans will also offer transportation to medical appointments and wellness programs, making them an attractive option for retirees looking for more comprehensive coverage beyond what original Medicare provides. However, these added perks often come with trade-offs, such as more restrictive provider networks or requiring prior authorizations for certain services. One of the key changes to watch for in 2025 is the shift in cost structures. While some Medicare Advantage plans will continue to offer zero premium options, out-of-pocket costs like copays and coinsurance may increase, especially for specialist visits or hospital stays. Retirees should also be aware of the annual out-of-pocket maximum, which can vary significantly between plans. In 2025, this limit may increase slightly, meaning you could pay more before your plan covers 100% of your healthcare costs for the year. When deciding if a Medicare Advantage plan is a better option than traditional Medicare, it's important to consider your healthcare needs. If you prefer more bundled benefits and don't mind using a network of doctors, Medicare Advantage could be a good fit. However, if flexibility in choosing providers or avoiding prior authorizations is a priority, Original Medicare with supplemental insurance may be a better option. It's all about finding the balance between benefits and costs that works best for you. Supplemental insurance, Medigap policies in 2025. Medigap, also known as Medicare Supplement Insurance, is designed to work alongside Original Medicare. It helps cover out-of-pocket costs that Medicare doesn't fully pay for, like co-payments, co-insurance, and deductibles. This can be especially helpful for retirees who want to limit their exposure to unpredictable healthcare expenses, particularly with the expected increases in costs for Medicare Parts A and B in 2025. In 2025, Medigap premiums are likely to rise slightly, but these plans still offer valuable protection. The exact cost will depend on factors like age, location, and the specific plan you choose. There are 10 standardized Medigap plans, labeled A through N, each offering different levels of coverage. For example, some plans cover the Part A deductible, while others don't. If you anticipate more hospital visits or outpatient care due to the Medicare changes, you may want to consider a plan with more comprehensive coverage to offset these rising costs. When selecting a Medigap policy, it's important to think about how much flexibility you want. Unlike Medicare Advantage, Medigap allows you to see any doctor who accepts Medicare without the need for a network. This can provide more freedom, especially if you travel frequently or need specialized care. Additionally, consider how much you're willing to pay in monthly premiums versus potential out-of-pocket costs, as some plans have lower premiums but higher out-of-pocket expenses. With the rising premiums and changes to Medicare in 2025, Medigap can be a smart choice for managing costs. Now, let's take a look at prescription drug costs under Medicare Part D and how upcoming changes will affect retirees' budgets. Prescription drug costs, Medicare. Part D in 2025. In 2025, Medicare Part D is set to bring some changes that will directly impact prescription drug costs for retirees. One of the most significant updates is the introduction of a new out-of-pocket maximum for drug spending. Currently, there's no cap on how much retirees can pay for medications in a year, but starting in 2025, a maximum will be set at about $2,000. Once you hit this limit, Medicare will cover all your drug costs for the rest of the year. This is a huge relief for those with expensive medications, as it could prevent them from spending thousands of dollars out of pocket. Another key change involves drug pricing reforms. Medicare will begin negotiating prices for certain high-cost medications, which could lead to lower prices for retirees. However, not all drugs will be included right away, so the immediate impact might vary depending on the prescriptions you rely on. Still, over time, more drugs will be added to this negotiation list, potentially bringing down costs for a wider range of medications. To manage rising drug costs in 2025, retirees should review their Part D plan during open enrollment. Switching to a plan that covers your specific medications more affordably can save you hundreds of dollars a year. Another cost-saving strategy is taking advantage of generic or lower-cost alternatives when available. Many plans offer lower copays for generic drugs, which can significantly reduce out-of-pocket expenses. With these changes, retirees will need to adjust their healthcare budgets to accommodate prescription drug costs. Let's move on to how you can effectively budget for these rising healthcare expenses while keeping your retirement finances on track. Budgeting for healthcare in retirement. Planning for 2025. Planning for healthcare costs is a crucial part of any retirement budget, especially with the changes coming to Medicare in 2025. As premiums for Parts B and D rise and out-of-pocket costs increase for hospital stays, doctor visits, and prescription drugs, retirees need to account for these expenses to avoid surprises. Healthcare is often one of the largest expenses in retirement, so having a solid plan in place can help you stay financially secure. One of the best ways to estimate future healthcare costs is by using tools like Medicare's official cost calculator or retirement planning software. These resources can help you project premiums, deductibles, and out-of-pocket costs based on your income, location, and healthcare needs. It's also important to consider factors like long-term care, which isn't covered by Medicare, and how much you may need to set aside for unexpected medical expenses. To adjust your retirement plan, start by reviewing your current budget and identifying areas where you can cut back to make room for rising healthcare costs. You may want to explore adding supplemental insurance, like a Medigap policy, to reduce out-of-pocket expenses for doctor visits and hospital stays. For prescription drugs, switching to a Part D plan that covers your medications more affordably or using generics can save you a significant amount each year. With careful planning, you can manage these rising costs without derailing your retirement plans. Now, let's look at how to maximize your Medicare benefits in 2025, ensuring you get the most out of your coverage while keeping your healthcare expenses under control. Maximizing your Medicare benefits. Tips for retirees. Maximizing your Medicare benefits in 2025 starts with taking advantage of the open enrollment period. This is the time each year when you can review your Medicare plans and make changes if needed. With the expected premium increases and coverage updates, it's essential to compare your current plan with others to ensure you're getting the best value. For example, switching to a Medicare Advantage plan with more comprehensive benefits, or finding a Part D plan that better covers your prescription medications could save you hundreds of dollars a year. It's also important to stay informed about the latest Medicare changes. Failing to stay up to date could result in missing out on new benefits or even incurring penalties, like late enrollment fees for Part B or Part D. By keeping an eye on upcoming changes and adjusting your plans accordingly, you can avoid unnecessary costs and take full advantage of what Medicare has to offer. Another key tip is to review supplemental insurance options like Medigap. As we've discussed, these policies can help cover out-of-pocket costs, particularly with the increases in hospital and outpatient care expenses in 2025. Taking control of your healthcare costs means being proactive. Review your plans regularly, consider switching if it saves money, and stay informed. Now, let's wrap up by looking at how you can secure a solid healthcare strategy to protect your retirement in the years ahead. Stay ahead of Medicare changes in 2025. In 2025, Medicare will bring several key changes that impact retirees' healthcare costs. Premiums for Parts B and D are set to rise, along with higher deductibles and out-of-pocket expenses for hospital stays and outpatient care. Medicare Advantage plans will offer expanded benefits but may come with higher copays and more restrictive networks. On the positive side, new policies will cap out-of-pocket drug costs and expand preventive services, helping retirees manage long-term healthcare expenses. These changes mean retirees need to be proactive in reviewing their Medicare coverage during open enrollment. By comparing plans and considering options like Medigap, you can minimize rising costs and avoid unnecessary penalties. Planning ahead is crucial to protecting your financial well-being and ensuring you're getting the most value from your Medicare coverage. Thank you for watching. Stay connected for more updates on retirement planning and Medicare changes. And remember to keep your healthcare strategy strong as you navigate these important changes in the years ahead.